Good evening, everyone. Welcome to Rehabilitation Sciences YouTube channel. And we are here with another very good topic, lose it with exercise. The sister, what to pronounce Dr. Sonam here?
The sister.
This is sister. And we have Dr. Sonam Chadda today as assistant professor, PDM University. He'll be talking about lose it with exercise, the sister. With some topics, and I'm very curious to know what it is today, and hope she'll tell us what this method and what this approach is. And moderator today, Dr. Sagun Agrawal, with us today, and he'll formally introduce our faculty today and start the session. Dr. Sagun, you can proceed with the session, sir.
Good evening, everybody. Welcome to the Rehabilitation Science Group. For the women's health topic, today we are having with us Dr. Sonam Chadda. She is Bachelor's in Physiotherapy from IP University and Master's in Physiotherapy from Delhi University. She has got publication in the Rehab Team magazine. She is the key researcher in the Women Health Physiotherapy, and she is working as an assistant professor in PDM University, Ballabgarh. She has got interest in the women health, and that's why she has chosen us this topic. We welcome you, Dr. Sonam, on Rehabilitation Science Group. I would like to take your consent. We are going live on YouTube.
Thank you so much. Thank you so much, Shagun sir and Dharam sir. Thank you for the warm welcome out there. Very pleased to discuss this topic, one of my favorites and one of, I think, most misdiagnosed or underdiagnosed topic, I would say. So coming to PCOS, the overall picture describes everything out there. We have we have causes, we have symptoms, and we have treatment out there. Coming to the PCOS, it is identified as a reproductive disorder, or you can say a metabolic disorder, which is characterized by enlarged sclerosistic ovaries. Sclerosistic means they are tiny, small cysts, which is present in enlarged ovaries. मतलब enlarged ovaries होती हैं PCOS में, and छोटे-छोटे cysts बनते हैं. Menstrual disturbances, irregularity, obesity, infertility, and hirsutism. Hirsutism is extra hair growth. Steele and Leventhal was the one who reported the syndrome in 1935, and therefore it is also known as Steele-Leventhal syndrome. Coming to the worldwide proportions of PCOS, so because of the lifestyle and dietary habits, the overall prevalence of PCOS have increased. So we have three diagnostic criteria to diagnose PCOS. So one is NIH, that is according to National Institute of Health. Second is Rotterdam, and third is Androgen Access Society. So according to three diagnostic criteria, we have prevalence 6%, 10%, and 10%, but that is respectively out there. Coming to the proportions, the prevalence have increased in cosmopolitan cities out there, like Tamil Nadu, like Mumbai, like Delhi, because of lack of physical activity and dietary habits. If we want to check out the prevalence of symptoms out there, like hirsutism, like polycystic ovaries, like hyperandrogenemia, that is also there, and we have found that the proportions are 28%, 15%, and 11%. But overall, the prevalence of PCOS found by Indian Council of Medical Research is 12.2%. I think which is very small in percentage, and this is a previous data actually, but I would suggest there are many people out there, many girls out there who will be having PCOS, but they don't convey their messages. So it's important to convey the symptoms and signs and take care of their signs and symptoms. Maximum prevalence of PCOS was seen between the age of 15 to 24. I think this is because of the adolescence factor and the change of hormones out there and the lack of physical activity and junk food intake. Least was in the age group of 35 to 44 years. PCOS is one of the most common causes of infertility. One of the most common complications of PCOS is infertility. and it has around 3.7 to 22.5% chance of occurrence in women. So the overall chances of PCOS occurring in a woman is 22.5. Coming to the signs and symptoms out there, the signs which we easily see and signs which we easily don't see plays a very important role and a different role out there. We can easily see and actually take into the diagnosis, that is irregular periods, menstrual irregularity. So we consider menstrual irregularity that is more than 35 days. If the cycle has increased to 35 days, it is considered it as normal according to today's lifestyle, according to today's researchers out there. Second symptom is anovulation. That means the female is not ovulating. Third, multiple follicles on the ovaries which are seen on the ultrasound. Fourth, insulin resistance or blood sugar issues. Then acne, specifically around mouth, chin, jawline, chest, and upper back. Hair loss, thinning on the head, that is known as hirsutism. Hair growth on unwanted places, anxiety, depression, mood swings, fatigue, cravings, depression out there. Weight gain, specifically around the middle, that means the central obesity is there. Blood tests show there is high level of LH-FSH ratio or excess of male hormones, that is testosterone and androgens. One more clinical symptom that is easily which we can see in PCOS patients is the dark patches on the skin, particularly on the neck around. PCOS affect your everything, actually, from adolescence to the middle age and to the old age. It has depression, anxiety, low esteem, diabetes, infertility like complications. But one of the most important complications is infertility. So it changes with you. PCOS changes with you. You have excess hair growth problem and acne in adolescence. Fertility, it will lead to fertility in the middle age. Then it will lead to complications like diabetes, insulin resistance, and cardiovascular issues in the later age of life. So there are approximately three mainly hormones, which are three imbalanced hormones, which can say in PCOS. First of all is insulin resistance that actually happens because of the alterations in the hormones out there. Second is the androgens, because there is increase in level of male testosterone symptoms and hormones, that is androgen and testosterone. Third, there is LH-FSH ratio. So generally the FSH gets decreases because the woman is not ovulating there, and LH increases, leading to increase in LH-FSH ratio. So this is a basic difference between the hormones of PCOS cycle and regular cycle. So in regular cycles, what actually happens, there is already higher follicle stimulating hormone that will stimulate the eggs to ovulate, and they will get ready for the fertilization and implantation. So this surge of LH is what actually triggers the evaluation, and FSH gets activated, progesterone gets released over there, and egg is formed. But in PCOS, everything is mixed up. LH, higher LH means that the follicle cannot mature. So if the egg is not maturing, if the follicle is not maturing, that means fertilization is not occurring. That means implantation is not occurring out. So LH is constantly high, so there is no surge of LH to trigger ovulation. जब ovulation ही नहीं होगा, तो fertility भी नहीं होगी. Due to these circumstances, the progesterone level decreases and there is less chances of fertility. So coming to the overall difference between a PCOS and the menstrual cycle. So in normal ovary, actually each month about 20 follicles starts to grow. These are the normal ranges, 20 follicles. That usually grows and only one matures. So at ovulation, mature egg that is released from the follicle that will move towards the fallopian tube, and it releases the follicle over there. Progesterone is released, uterine lining thickens, and period follows. But in PCOS, the body itself doesn't make the hormones for the egg to get matured. बॉडी के अंदर वो हार्मोन्स ही नहीं है कि एग बन सके ओवरी के अंदर ताकि फर्टिलाइजेशन हो. So the follicles grow but none matures. some remain as cysts. तो वो जो follicles थे जो हमारे normal cycle में बन रहे थे, पर PCOS में वो बहुत छोटे छोटे tiny cysts बन जाते हैं एक enlarged ovary में. So no egg is released, no progesterone is produced, uterine lining doesn't thicken. So overall, egg is not matured and fertilization doesn't take place. Factors that causes PCOS, I think it's one of the most common causes out there. First is weakened immune system that can be treated out with dietary habits and supplements. Bad dietary choices that we can switch to natural and organic foods over there. Accumulation of toxins if we stop eating junk food and exercise. Insulin resistance and obesity, we can treat it by meditation and exercise. Genetic tendency, be joyful always to alter the genetic tendency. Yes, adolescents vulnerable group, and I think adolescents is the one who gets PCOS very easily, but they often ignore the symptoms out there. So they will have the similar symptoms: mood swings, acne, fatigue, insulin resistance, high testosterone levels, and the signs and symptoms of the extra hair growth, excessive body hair growth, male pattern balance is there, irregular or missed periods is there, low sex drive is there, ovarian cyst is there. So, and weight changes are there. Considering the weight changes, I would like to say that it doesn't mean every PCOS patient will have increase in weight or is obese. ऐसा नहीं होता हर patient obese हो. It all depends on the hormones and lack of physical activity and body structure on it. I have seen patients who were not obese. 80% of the patients were not obese in my research. All of them were according to their BMI. So all of them were of the normal weight. So this is a misconception that obese patients will have PCOS or PCOS patients are obese. Yes, they are more prone to have obese. Obese patients are more prone to have PCOS, but all patients are not obese. The most important, I think we need to know about what is the difference between a PCOD and PCOS. Both the terminologies are used worldwide, but the differentiation is there. PCOD is basically consists of mild symptoms like irregular periods out there, extra hair growth, or acne. They will not have complications of diabetes, of cardiovascular diseases out there. So it can easily be treatable. Coming to PCOS, they will have the symptoms of irregular menstrual cycle, acne, excessive hair growth, but the complications are too much high. They will have diabetes, they will have insulin resistance, they will have cardiovascular issues, or most importantly, PCOS patients have musculoskeletal issues out there. So that is also very important. So PCOS is more serious than PCOD. There is high risk of developing type 2 diabetic mellitus, cardiovascular issues, and obesity. Issue with fertility, that means infertility is there in PCOS patients. Ovulation is not happening properly. Ovulation PCOS में होगा ही नहीं. That is not happening, and because of that, infertility is there. But whereas in PCOD, ovulation happens, but it is comparatively not regular. PCOD के comparatively, PCOS के comparatively, PCOD में जो ovulation है वो regular होगा, but not exactly what's the normal ovulation is occurring. PCOS में ovulation होगा ही नहीं. Symptoms are visible at an early stage in PCOS. So symptoms जो होंगे generally वो in the adolescents between the age of 15-20, this starts growing out. They have diabetes, they have cardiovascular issues, they have low aerobic capacities out there, and musculoskeletal changes. Whereas in PCOD, symptoms are not easily visible and often they are ignored. The patient is having irregular menses, the patient is having acne out there. But normally, जो हमारा already एक scenario है कि ये तो होता ही है, periods delay होते ही हैं. This should not be there. You know, the irregular of menses is not normal, and we need to consider this is one of the major causes of musculoskeletal pain in musculoskeletal system out there. Coming to the hormonal part, we have pituitary gland that releases excess of luteinizing hormone. that causes increased production of male hormones that are androgen and testosterone from the ovaries. So if the male hormones are occurring in high amount, so that means there will be causes of failure of busting of egg follicle from the ovaries, which will lead to undischarged egg follicle that will become a tiny cyst. And this process gets repeated during every menstrual cycle, which lead to multiple cysts leading to PCOD or PCOS. So there are hormonal alterations which are the main criteria to diagnose PCOS. We have diagnostic criteria out there. Now for the National Institute of Health in 1990, we have chronic anovulation. अगर किसी को ovulation बहुत time से हो ही नहीं रहा है, this is the one of the feature which we notice in diagnosis. Second, we go for hormonal testing out there. We have biochemical signs of hyperandrogenism, so we go for hormonal test. But coming to the Rotterdam criteria, we have if the patient is having anovulation or anovulation. So anovulation is the complete loss of ovulation out there. And oligoanovulation means that the patient is ovulating but in irregular manner. Ovulation हो रहा है but irregular नहीं हो रहा, उसको हम बोलते हैं oligoanovulation, and is not occurring at all. It is known as anovulation. Next, we see your hormonal testing over there, biochemical signs of hyperandrogenism and polycystic ovaries on the ultrasound. Coming to the next criteria, which is known as Androgen Excess PCOS Society, and this is the main society which is already dealing with PCOS researchers out there. So if both criteria are met, clinical or biomechanical signs of hyperandrogenism are seen, the first feature. Second is ovarian dysfunction, that means oligoanovulation or polycystic ovarian morphology. So we see actually the hormonal test, we see ultrasonic polycystic ovaries over there and menstrual irregularities. We see these one of the main clinical features out there to diagnose PCOS. PCOS has reproductive, psychological and cardiometabolic features, and it is associated with many long-term complications and adverse health problems out there. The main complications are infertility, obesity, impaired glucose tolerance, type 2 diabetes mellitus, and cardiovascular issues, and even sleep disorders, insomnia, depression out there. We have short-term complications and long-term complications in PCOS. For the short-term complications, we have obesity, infertility, irregular menses, abnormal lipid levels, excessive hair growth, acne, hair falling, and thinning. And these are the complications which can be easily treatable out there. But when we come to long-term complications like diabetes, endometrial cancer, and cardiovascular diseases, these are hard to treat, and often if the patient is in the adolescent stage and if she is already having diabetes, so we can imagine how many consequences of the health hazards she will be having. I want to discuss a case. I saw a patient of 18-year-old girl with type 2 diabetes and insulin. She was on insulin from quite long time, from approximately 5 years, just because of PCOS out there. So we can actually imagine how much PCOS has caused the health hazards of diabetes and cardiovascular disease out there. Coming to the musculoskeletal changes out there, there are some of the researches which have been done to check how much flexibility and how much aerobic capacity they have. So coming to the researches, it has been shown that 65% of women with PCOS have higher body mass, which is exceeding 27. That means they were obese. There was one author, Oreo. He was the first one to evaluate cardiopulmonary functional capacity in PCOS patients. But he concluded that VO2 maximum, oxygen consumption at anaerobic threshold, and maximal workload at peak exercise were reduced in PCOS subjects. So overall, their aerobic capacity, their VO2 maximum level was reduced in comparison to healthy women. This was my work. I actually evaluated considering all the fitness of which we have components of the physical fitness like flexibility, like muscle endurance, like strength, like body composition parameters and aerobic capacity. So I reported that physical fitness of PCOS individuals were found to be relatively low as compared to age-matched controls. But still, we are having lack of studies in this field. We need to evaluate some more parameters out there to rule out what are the exact musculoskeletal changes which are occurring in PCOS. Uh, there are some of the another components in physical fitness, like one of them is muscle strength. I would like to talk about. For considering the muscle strength of PCOS patients, there are some of the researches which has shown that PCOS patients have high muscle strength or the same muscle strength in terms of in comparison to normal individual. So was a new thing which I have read, and I came across that the reason they had given is because of high level of androgen, because of the high level of male hormone in it. The muscle strength of PCOS patients have shown to be higher in terms of in comparison to normal individuals out there. But it depends on all musculoskeletal changes which already has been there in the PCOS patients. Since I found that their muscle strength was comparatively low, so it depends on researchers to researchers and person to person what kind of musculoskeletal changes the person is having. It is because of hormonal alterations out there, or it is because of posture alignments out there, because of the lifestyle out there. So we need to rule out. We need to rule out the musculoskeletal changes. Why musculoskeletal changes are occurring? Is it the hormonal alterations out there, or just because of the normal lifestyle? So coming to the hormonal alterations in PCOS, we have androgen elevation, high level of androgen is there. And if high level of androgen is there, it is associated with reduced cortisol. If reduced cortisol is there, it will interfere with the TNF factor, that is tumor necrosis factor, and this factor will impair the bone formation. बोन की फॉर्मेशन नहीं होगी एंड्रोजन इंक्रीज होने की वजह से, तो मस्कुलोस्केलेटल चेंजेस में जो डिफरेंसेस हैं वो बढ़ेंगे. Second comes estrogen reduction. Since estrogen is mainly required for the maintenance of bone in women, so reduction in estrogen will impair bone formation and increase the osteoclastic activity, that is the bone reabsorption. Elevated LH-FSH ratio is there, which will lead to elevated androgen levels and will result in bone formation. Increased insulin level resistance is found to increase bone reabsorption by decreasing osteoprotein and increasing the rankle expression. So increasing the rankle expression, so rankle expression is mainly required for the osteoblastic activity. Vitamin D reduction. Vitamin D is an important factor of calcitrophic hormone, which is required for the maintenance of bone. So hence, if there is reduction in the vitamin D, it will impair the bone formation. PTH elevation, which is required for the bone reabsorption. So elevated PTH will increase bone reabsorption and decrease bone formation. Growth hormone reduction through IGF directly stimulates osteoblast cells for bone formation and osteoclast for differentiation. So if there is decreased level of growth hormone, that means bone formation will decrease. Cortisol reduction, it probably result in increased TNF factor and thus impair bone formation. So all of the hormonal alterations that are occurring, androgen excess, cortisol reduction, vitamin D reduction, estrogen is high, estrogen reduction is there, testosterone is high, all of them are leading to bone decrease in bone formation out there, and they are increasing the bone reabsorption. तो अगर कभी भी हमारी बॉडी में बोन फॉर्मेशन अगर कम होगा, so that means muscle strength, flexibility, all of the changes in the musculoskeletal system will occur. So coming to the dietary modifications of food which are to be taken, we have high fiber foods like oats, green leafy vegetables, avocados, broccolis, almonds, beans, natural and unprocessed food like milk, curd, buttermilk, fruits of berries, fish oils, and tuna. Foods that are to be avoided, that are sugary diets, that are fried food, fast food, excessive raw meat, solid fat, soda, caffeinated drinks, and alcohol. So these are generally the foods which increase the hormonal alterations. So we need to avoid the foods which will increase the hormonal imbalances in the body. Coming to the physical activity out there, since the overall physical fitness of PCOS patients have found to be reduced, their flexibility, their muscle strength, their muscle endurance, all of them have found to be decreased. So we will plan according to that only. So I just consider it depends on patient to patient. If the patient is having low flexibility level, low cardiovascular level, low agility level, then we plan treatment of PCOS according to the patient's symptoms out there. But overall exercise participation of at least 150 minutes is necessary per week. That is should be recommended in women with PCOS, specifically who have their BMI that is more than 28. Of this, 90 minutes per week should be aerobic activity at moderate to high intensity. Moderate to high intensity, that means 60% to 90% of maximal heart rate, which actually will optimize the clinical outcomes. But we have mainly manual therapy out there, which has shown very positive results in terms of PCOS and infertility. So if almost all of the PCOS patients are having infertility, so we will be dealing with some of the manual techniques right now, how to deal with that in terms of PCOS patients and infertility. We have barrel visceral manipulation out there. So visceral manipulation are generally done to mobilize the organs to increase the blood flow to the particular area and to decrease the restrictions or adhesions out there. So for PCOS, particularly a PCOS patient, if I talking about how to manipulate the uterus out there, the patient is in supine position out there with knees flexed. So both of the knees of the patient are flexed, and therapist gently palpates just above the pubic symphysis where our rectus abdominis is attached. Therapist generally palpates towards the rectus abdominis just above PSIS at pubic symphysis, and then he gently puts pressure with two hands to check if there any restrictions out there or adhesions out there. In the second picture, which describes the treatment out there, so the therapist generally just hold that area of the uterus out there, that is the fundus of the uterus. He will just hold that area and gently he will put a pressure and manipulate. All these the techniques, it will increase the blood flow to the uterus and increase the mobility and decrease the adhesions out there. So our main motive of visceral manipulation is to decrease the adhesions around the perineum area or and around the genital area. So the patient is in the supine position, legs bent, held passively by the practitioner. He will be placing a hand on the abdominal wall above the symphysis, that is contralateral to the area where rectus abdominis is attached. With cautious pressure, reach the area lateral to the fundus of the uterus. He will be checking with the mobility by pulling transversely towards himself, taking the note of sensitivity and atypical tensions. So the more the legs are flexed, the easier to perform the procedure because the abdominal muscles are relaxed. Treatment, actually we can just put on the both hands simultaneously and both sides of the uterus and mobilize one in translation. So it is important to provide sufficient flexion of the hip and knee to relax the abdominal wall. This is the manipulation of the uterus which we have read. Now let's manipulate ovaries out there. Coming to the starting position, the patient is in the supine position with legs bent. The practitioner stands just next to the patient. Procedure out there, we will visualize the projection of the ovary on the abdominal wall. That means just standing opposite to the patient, we will visualize the ovaries. Coming just parallel to the ASIS line, we will palpate the ovaries and note down any additions or restrictions or bands over there. and then we'll manipulate accordingly, and then we will apply visceral manipulation with a gentle pressure. Since ovary is a very sensitive part, and after generally after just a normal touch, the patient will have pain. So we will be very gentle with our pressure. We have to be very gentle with the pressure which we are applying. So by visualizing the projection of the ovary on the abdominal wall, the therapist will place hand on the abdomen on a line ASIS symphysis slightly that is medial to the edge of the psoas major out there. He will be sliding hand slowly into the depth posteriorly until he will reach the testing region, and until he just feel the adhesions out there. He will test the elasticity by comparing the both sides and will take down note of sensitivity and atypical tensions. As the area is very sensitive to touch, always proceed with caution. We can now give the treatment relaxation of the ligament and by means of inhibitions, vibration or small rock. That means we can put pressure in the circular motion also, or by giving through vibrations also. So the application of these specific manual therapy modalities are thought to activate the central nervous system. We are actually activating the hormones to central nervous system by stimulating a tissue response and thus increasing the communication with higher control centers to the brain that will have a positive impact on the hormones, on the activity of the ovary and uterus. What we are actually doing is we are stimulating the uterus and we are stimulating the ovaries to actually activate and to actually perform their functions normally. तो जो हमारा नॉर्मल इंडिविजुअल नॉर्मल वुमेन में होता है कि नॉर्मल हार्मोन्स आर सेक्रेटिंग आउट, testosterone is not there, estrogen is normal, progesterone is normal. We have to activate through visceral manipulation in that way. The adhesions actually they act like an internal glue and they actually block fallopian tubes. So they cover the ovaries so the eggs cannot escape. If the eggs is not able to escape, then how the fertilization will occur? The implantation will not occur, the fertilization will not or form on the wall of the uterus, decreasing the chance of the implantation. Mainly the reproductive structures we have, genital area we have, they actually require mobility. So we are actually increasing mobility, decreasing the adhesions through visceral manipulation, and the increase of blood flow. The increase of blood flow and nutrients to a particular area actually increases the physiology of a particular organ or a tissue. So we are basically working on the physiology of the uterus and the ovaries in visceral manipulation. We have another therapy by Mercer's therapy, which is known as Mercer therapy. Mercer therapy was created by Dr. Jennifer Mercer. It is a deep pelvic organ visceral manipulative technique in which the reproductive organs are mobilized and blood flow is restored. So all of them, the previous technique and this technique, they have only one phenomena, that is to mobilize the ovaries out there. Organ restrictions are relieved and movement is replenished amongst the organs, and surrounding structure is enhanced to enhance the natural and the optimal function of the ovaries and the uterus. Mercer therapy is created to optimize health and well-being within the female by addressing scar tissue and decrease mobility of the reproductive structures. The gentle and non-invasive technique is very beneficial for women of all ages and even in other pelvic diseases like gynecological surgeries, after gynecological surgeries, pelvic pain, or having gone through traumatic birth experience. So Mercer therapy is very common in these conditions also. Mercer therapy can be used as a stand-alone regime or in preparation for a medically assisted cycle such as IVF. So if the patient is already undergoing IVF also, then side by side Mercer therapy is also very successful. There are high chances of success rate in Mercer therapy, about 83% of success rate is there. Coming to the aerobic exercises, we have aerobic exercises for PCOS patients out there to increase their aerobic capacity and cardiovascular fitness. So we have cycling, we have swimming, walking, running, skipping and hiking. If we have to decide the dosimetry, we generally recommend 20 to 30 minutes of exercise per session, 3 days per week in aerobic exercise. If the weight loss is your goal, then we have to go for up to 4 to 5 days per week. So that means we are increasing the frequency per week. But guidelines for a healthy lifestyle states that very few individuals lose weight by participating in 30 minutes. Since yes, the patient can be obese and the BMI can be very high, so we can increase the intensity of exercise by increasing the dosimetry of aerobic exercise. So to prevent weight gain, 60 minutes of exercise is recommended. To maintain weight loss, 90 minutes is recommended. But to gain health benefits, we have 30 minutes of daily activity, which is recommended. And if the exact goal of the treatment is to lose weight, we should always go for 4 to 5 days of aerobic exercise per week. These are some of the stretching exercises which we should follow in PCOS patients. General body stretching of the upper limb and the lower limb. But yes, we have specific stretching in the form of yoga asanas in PCOS patients that we will follow. For the stress management, we have techniques like breathing exercises, lukewarm water bath with Epsom salt, relaxation exercises, meditation, and different kind of hobbies for diverting the mind. Because since PCOS is having too much of complications of obesity, infertility, and your diabetes and cardiovascular issues, so patients are more prone to have depression out there and anxiety out there. So approximately there has been researches that has shown PCOS patients are having 30 to 40% of depression symptoms. So to rule out the depression is also important, and to give treatment in the form of breathing exercises and meditation is equally important. For the strength training, we have frequency around 2 to 3 days per week for approximately 12 to 24 per weeks. Intensity 60 to 70 of 1 repetition maximum, comprising 3 sets of 8 to 10 resistance stations, and total time 30 to 45 minutes. So overall strength training, we will be strengthening the upper limb and the lower limb in the form of the biceps curl, planks, squatting, deadlifts, and all the exercises with the exercise and therapats. We have yoga asanas specifically for genital area and the perineum area. So all these asanas, they have a physiology of increasing the blood flow to the perineum area. So if we are increasing the blood flow to a perineum area, so naturally the physiology of ovaries changes and PCOS gets reversible. There's mild churning pose, Chaki Chalasana, which is maintained to be for 1 minute. We have cat and cow pose, which is also very useful in the back patients out there. We have child pose, the Balasana pose, which is very helpful in treating out PCOS. We have butterfly pose. So for the butterfly pose, has to be maintained at least for a minute, and it can be done in the sitting position also and in the supine position also. Next, the most important asana which I have came across according to my experience of PCOS patients is Malasana. Malasana is the most important stretch that is need to be carried out in PCOS patients, because it is exactly putting the pressure on perineum area, and they are stretching the adductors and the perineal structures out there. Therefore, it is increasing the blood supply, particularly to that area. And we have to increase the blood supply to increase the mobility and the physiological parameters of the organ. So coming to the overall summary out there, yes, the overall physical fitness of PCOS patients is reduced. So we need to work a lot upon the physical parameters of the patient, the PCOS patients. Since PCOS is a clinical condition characterized by menstrual irregularity, hirsutism, and they have too much of complications like diabetes, cardiovascular factors, endometrial cancer. So we need to pay some extra attention to that. So we have, I think many of us are dealing with normal neck pain patients and back pain patients out there. But I have found that many of the PCOS patients are there, which we usually come with back pain, But normal, after having a word with them, I have realized that they actually have hormonal alterations and they have PCOS. So we need to examine the relationship between musculoskeletal changes that we think as a physiotherapist is happening just because of lack of physical activity and ergonomic habits are there, abnormal habits are there. But what exactly it is happening? It is happening in the hormones. So we need to find out the relationship between PCOS and musculoskeletal changes, and then we can work accordingly. Because so I have seen the patients who generally didn't have very much irregularity in their menses. Their menses sometimes were there regular, but sometimes they were irregular. So they were also not confused about the menstrual irregularities, and they were also not opening up. So I think the prevalence of PCOS and the clinical outcomes of PCOS and treatment options of PCOS are need to be ruled out according to the signs and symptoms, and in consideration with the relationship with the musculoskeletal changes, so that we can work on the hormones also. For the hormones, we have medications, we have surgeries out there in PCOS, but as a physiotherapist, we have to work only on the exercise, because the side effects of medications out there are too much in PCOS. So I think we should work on according to the signs and symptoms and musculoskeletal changes out there. So let's take a step towards women health, and I'm always there in fight to win against PCOS always. So you can reach me out here at the given number and the mail ID. Thank you so much. This all ends with my session. Thank you.
A very good evening, and thank you, Dr. Sonam. I think you have raised a very important topic today in terms of not only women health, but also about lifestyle and its effects on adolescent health of young girls. And most of the factors, as you mentioned, are modifiable when you talk about the physical activity and the diet. And it is so important that awareness and education should start early about these factors. Dr. Sonam, there were conflicting ideas about obesity in
Yes.
your talk. And I just wanted to know, like, you mentioned at some point that obesity has no relation to PCOS. But whereas in the later part of your presentation, you did mention that the BMI is high. And even in the features, there was a mention of central obesity in such patients. So at the end, so how should we conclude the relation of obesity to PCOS or PCOD?
So I would like to talk about, am I audible to everyone out there?
Yes, ma'am.
Yeah. Uh, I would like to talk about the obesity part, because some of the researchers have shown that their overall their BMI is increased. But obesity is not a dependent factor for PCOS. So, which I have seen in my research, the 80% of the individuals were not obese, 20% were obese. So I think it depends upon the populations which we are dealing with, and exactly what are the physical parameters which we are looking into. Yes, the BMI can be a factor out there with increase of central obesity, but it is not a prominent feature, I would say. So it is not exactly what we will keep in our symptom out there, that the
Right.
PCOS patients will be obese. No, they will not. They can be obese because of the hormonal alterations. But I think if we treat that hormonal alterations at an early stage, it will not lead to central obesity or obese patients. So there is conflicting researches about it. But as per my dealing with my researchers, so I have found that many of them were not obese. So it all depends on hormonal alterations, how the patient is reacting, how her body is reacting to that hormonal alteration.
Right, right. And I think you have very rightly mentioned that the therapeutic approach is most often individualistic. And I think that is very important, considering the cultural and the social factors. And this is, I think, what is the difference between your study and some other studies. And this is
Yes.
what we have seen in maybe in India, it is not that big a factor. Dr. Sonam, in your diet management, there were a few options that are not very readily available in India, or are
Yes.
on the higher socioeconomic side of the social strata that everybody cannot afford, maybe like avocados, like broccolis,
Avocados.
and even the awareness of such things is low. So do you recommend any everyday diet modification that people in India, even irrespective of their socioeconomic strata, that they can follow?
Yes, there are some leafy vegetables out there. I think fruit. In terms of fruit, we talk about they should not take the fruit juices. जो हम fruit juices लेते हैं, they have a higher sugar intake. So, but we have to take fiber-rich foods, right? So we will go for green leafy vegetables and normal fruits intake, but particularly the green leafy vegetables. And to maintain the calcium levels and the vitamin D levels, it is important to go for milk and the curd part, since there are researches that have been shown that curd has been given in the PCOS patients in comparison to milk. So there were also differences between the milk consumption and the curd consumption. And the patients who were having curd, particularly, they were having higher calcium and vitamin D level in terms of milk. So if you take curd or milk or green leafy vegetables or just normal nuts, walnuts, nuts, almonds, or walnuts, that is also enough. But the most important thing, I think, which is more important, is to avoid junk. That plays a very much role, because
Right.
if you are doing not doing physical activity and then eating junk, then also plays a role. So eating junk should be that is the most important thing, and maintaining the physical activity. That is the
Very
second.
right. Very right. Lastly, in the management, I think a very important aspect of management was told about visceral manipulation, and a lot of people either are not aware, including professionals, or are not certified to do that procedure. So I think that was the highlight of this presentation, that I think people should get more interested in understanding that. I just wanted to know, are there any negative effects of maybe manipulating or mobilizing the viscera? Or do you have any difficulty in people who are obese or palpating so deep in the structures?
Yes, there are some signs and symptoms like vomiting or the abdominal issues out there in some of the patients which I have seen. But yes, coming to the obese part, it is very difficult. But I personally think if you are very keen to learn something, if you are very keen to treat patients, it doesn't matter to me whether the patient is obese or not. Yes, it takes time to actually palpate the organs. It takes a lot of practice actually to where is the visceral organs, where is the ovary, where is the uterus out there. But I think if you're very keen to treat patients and to treat infertility, particularly in PCOS patients, so you actually learn with the time and practice and reading. Yes, there are difficulties out there, but I think every physiotherapist must read and practice it by any or the other means. Doesn't mean if they can actually practice upon themselves also. So that makes a man perfect by actually evaluating. If we don't know how to palpate out uterus, palpate out ovary, how can we actually manipulate it? And to put that pressure is also very important. अगर बहुत ज़्यादा pressure हो जाता है तो eventually the patient will wince and say कि मैं तो करवाऊंगी ही नहीं. I don't want to go for these procedures out there. So yes,
Mhm.
there's a side effects, but I think we are very far from this technique right now in particularly in women health in visceral manipulation. So I would really like to consider this as a fact that we should always pay attention to women health, specifically to this technique, because I think it is actually will work on the physiology of the visceral organs.
Right. So with this note, we thank you for sharing this wonderful information.
Thank
And
you.
there were a lot of takeaway points and awareness aspects for a rehabilitation therapist from this talk. Thank you so much for being with us today.
Thank you so much, sir. Thank you so much. It was my pleasure. Thank you.